So what are the top three things in your mind on changing regulatory and reimbursement situations in the business right now?
Sure. So as a wound specialist, the things that really keep me up at night is the fact that there are millions of people with chronic wounds around the world, but particularly in this country, we're seeing chronic wounds increase at a staggering rate. And they're not necessarily recognized. Everybody knows about a pressure ulcer or a pressure injury because of litigation, but a lot of people don't realize all the other wound types that are increasing with diabetes and obesity and lifestyle. And certainly as we're all aging and we're living longer with more chronic conditions. And a symptom of that is that chronic wound. And so what's upsetting is, I don't think we are adequately prepared in school. And when I say we, I mean the entire team, from physician, provider level, physical therapy, nursing, dietary, the dietitian. None of us are adequately prepared in school to meet this need, but there's an expectation that we should be. So in the field, we're expected to be able to recognize wound types and treat these individuals, and the quality measures also say we need to heal these people. And I think the thing that's most bothersome about that is we probably can heal a lot of people, but that individual has to be game. So that individual who's 90 years old in a nursing home has to be willing to go to a procedure to get bone debridement. They have to be willing to eat a strict diet and take supplements and get more mobile. And the reality is it could take months, if not years, to heal that chronic condition. You have to focus on lifestyle. And if that individual isn't interested in that direction, that's their right. And it's our role to make sure we explain the benefits and the risk and the options. But the reality is we can't heal all people if that individual doesn't have an interest in that track. And that might not be the best way for them to have a quality of life at the end of their life. And so, the team doesn't always recognize that. And as we get more people with wounds, I think the public perception is if you have a lot of wounds in a facility, it's poor quality. And I would challenge that and say if you're accepting a lot of people that are debilitated and have a lot of chronic conditions and are on a lot of medications, you're going to have a lot of people with wounds. And we have to figure out a way to prepare clinicians adequately at a school level so when they're in the field, they're prepared for this population that's really coming at us right now.
So that would be the best way, you think, education at some level to inform physicians or nurses, et cetera?
Yes, it's education, but it's not just education on this is how you treat a wound. And I think that's what a lot of people think. It's education about how do we work together as a team. So right now we have all the right players under every roof of a nursing home. We have our providers and our therapists and dietitians and nurses, but the education needs to be how do we function together? So we can really leverage our individual expertise. We can all work top of license and really get the biggest bang for the buck. And we can also talk to the patients and families, because right now I think most people are afraid. We're afraid because we have limited education in that area, and we're afraid because of the litigation surrounding the whole idea of wound management. And so it is education, but it's not just education on this is a wound and this is the Band-Aid. It's the education of how do we truly become a team, especially around wound management.
Excellent.